Okay, can you guys see my screen? Okay.
Yes.
I'm gonna move some things around 'cause the pictures are in the way. Okay. So shout out to Dr. Janice Sinowski. I absolutely loved your presentation on leveraging QR codes. I absolutely enjoyed it. So my presentation would be like, okay, so what are the perceptions when we do leverage QR codes in the classroom? So again, good morning, and my name is Dr. Casaundra Wyatt, and I'm a clinical assistant professor of nursing at Kennesaw State University in Georgia, and I am delighted to share my poster board with you all. The title of my study is Perceptions of Integrating Quick Response Codes in Associate Degree Nursing Education. At the time of this study, I wasn't teaching at Kennesaw State University. I was teaching at a local community college or a technical program that enrolled associate degree nursing students. And I recruited those students to participate in the study. So I had a bit of a convenient sample there. So for the past 7 years, I've held an interest in QR code technology. And this was back when they were not as popular as they are today. The COVID-19 pandemic has greatly increased the visibility and the usability of our QR codes. I found that QR codes is an interesting way to connect students to just-in-time learning without the hassle of running to the copier room, trying to Xerox copies and make all these copies from anywhere from 50 to 100 students. And once they complete the activity, they just leave the paper on the table and go home. But no, with these QR codes, we can embed things like heart sounds, lung sounds, fetal heart tones. I embed case studies, NCLEX style questions. I connect these QR codes to videos and things like that to spark their interest. I also like to embed inspirational messages inside the QR code. I create a QR code and I'll say, guess what's inside? You know, that just excites them and intrigues them, and they really want to open it up and scan it. And it's just something inspirational just to keep them going. I embed pictures in the QR code, pictures from when they were junior students, and then a picture at the end of the program where they're seniors getting ready to graduate, and they absolutely appreciate it. It's just so much that we can do with QR codes. Like we mentioned before, QR codes is a two-dimensional barcode that direct users to the sites, to different sites where they can look at objects and pictures. It takes them to different places. QR codes have been used in various industries and settings. Now I can truly say they are ubiquitous because we see them everywhere. So at the time of my study, I was reading some literature from the National League for Nursing and the Institute of Medicine, and they were calling for nurse educators to incorporate technology into their teaching. And this leads me to the introduction of my poster board. So quick response codes augment learning experiences and supports the American Association of College of Nursing and the National League for Nursing and Institute of Medicine initiatives for nurse educators to teach in a technology-driven environment. Teaching with technology motivates students to learn and engages them in active learning that stretches beyond the walls of the classroom. Once they have that QR code and they download it, they can save it and they can keep it. Exploring nursing faculty and students' perceptions of integrating QR code technology as a viable teaching and learning strategy enriches the environment as well as advances the initiatives of AACN, NLN, and IOM. Quick response codes are the two-dimensional barcodes that combine pedagogy and andragogy to bring learning out of the classroom and into a natural and authentic space. So the purpose of my study, the purpose of this mixed method study was to explore the perceptions and experiences of utilizing QR codes in an associate degree nursing program. I had 2 research questions. One question, what are faculty members' perceived benefits of utilizing QR codes in the classroom? And the second question, what are the students' perceived benefits of utilizing QR codes in a classroom? So for my methods, a mixed methods triangulation convergence design with descriptive data was utilized for this study. The study occurred in a natural setting at one institution of higher learning in the Southeast region of the United States. The sample included 81 nursing students and 5 nursing faculty from an associate degree nursing program. Data collection tools consisted of a demographic survey, a QR code survey for the student and the faculty, and an interview protocol for our faculty. Descriptive statistics were employed to explore students and faculty members' perceived benefits, perceived ease of use, attitude, capabilities, and intentions to use QR code technology. And SPSS was used to help with the descriptive statistics. Thematic analysis was used to explore nursing faculty perceptions of QR code technology in the classroom. And I also did manual coding as well as QSR and in vivo assistance. Now for the results, so I had to condense this down for a poster board presentation. So I just pulled out just pertinent things that kind of just stuck out to me. So the first chart, we see the kind of yellow and purple chart here. That chart is the interview protocol. So it's 5 questions. So these are faculty members' qualitative and the thematic analysis. So for the first interview question, it states, what is the purpose? What is the nurse educator perception of QR code technology in the classroom? And some of the themes that emerged from that was enjoyable. It's a positive learning strategy. There's quick access to information. It has generational student appeal. The second interview question, how can QR codes be used in the nursing curriculum? And some of the responses that I got, it can be used during a flipped classroom experience. We can decrease the use of paper in the classroom, and that is a versatile learning strategy. The third interview question, what are faculty members' perceptions of support for technology in the classroom? And some of the faculty stated that there's a high support for technology, and sometimes students do have difficulty using technology. The fourth interview question, what technology is currently used in the classroom? And some of the things that came up was simulation, PowerPoints, Kahoots, any type of online gaming. The fifth interview question, how can nurse educators explore creating a repository of shared teaching and learning resources focused on the use of technology in nursing programs? So basically they said using a cloud or some type of internet-based document sharing to help with that. And again, I had 5 nursing faculty to participate in the study. So the next chart we're going to look at is the faculty members questionnaire, which is the chart down here. So I pulled out 5 pertinent questions. The questionnaire was actually 20 questions, but I just pulled out only 5 for the poster board. And they were Likert scale type questions with selections that range from strongly disagree, disagree, neutral, agree, and strongly agree. So the first question, QR codes enable quick access to information. 100% of the faculty agree that it do enable quick access to information. The second one, QR codes enhance the quality of learning. All five faculty 100% agreed that they do enhance the quality of learning. The third question, QR codes motivate students to learn. All faculty again agreed that QR codes motivate students to learn 100%. The next question, overall, QR codes are easy to use. Again, all faculty 100% agreed that QR codes are easy to use. The last question, I intend to use QR codes in my teaching, and I was happy to when they said that all of 5 did agree that they will start using QR codes in their teaching. So the second chart that we're going to look at is the student questionnaire. So this is the chart right here. So again, the student questionnaire, I pulled out 5 questions. Again, 5-point Likert scale. The first question, QR codes enable me to access information more quickly. Again, 81 students, 96% agreed that the QR codes enable them to access information quickly. QR codes enhance my quality of learning, 74% agreed. QR codes motivate me to learn, 69% agreed. Overall, QR codes are easy to use, 97.5% of the students agreed. The last question, I intend to continue using QR codes my learning, 63% agreed and 32.1% were neutral. The last chart is the triangulation chart. So this chart here. So it was also very surprising when I was able to see some of the data converge from two different sources. So for the first theme here, which is quick access to information, the qualitative finding was 4 out of the 5 faculty expressed to me that QR codes provide quick access to information. And that data converged with the quantitative finding, with 100% of the faculty agreeing that QR codes do provide quick access to information. The second thing, versatile learning strategy, 5 out of the 5 faculty indicated that QR codes are a versatile learning strategy, and that one converged with several of the questions. 60% of the faculty agreed that the QR codes make it easier to learn. 100% agreed that QR codes support independent and collaborative learning. 100% agreed that QR codes support multiple learning styles, and 100% agreed that QR codes bring variation to the classroom. The next one, positive learning strategy. 4 out of the 5 faculty expressed to me that QR codes are positive in the classroom, and that converged with the quantitative finding, with 100% of them agreeing that QR codes enhance the quality of learning. 100% agreed that QR codes enable more class participation, and that 100% believe it is a good idea to use QR codes. The next theme, enjoyable. 3 out of the 5 faculty expressed that the QR codes are enjoyable, and this converged with the quantitative finding, with 80% of the faculty agreeing that QR codes motivate students to learn. The next one, high support for technology. 100% of the faculty, or 5 out of the 5 faculty, expressed to me that there is support for technology, and this converged with 100% of the faculty agreeing that they're going to use QR codes in their teaching, and that they plan to use QR codes in the future. So this takes me to our implications. So implications for nursing education include equipping nursing faculty with knowledge and training needed to successfully implement innovative technology in the classroom to better prepare students for nursing practice. And sometimes it's very hard. Sometimes faculty are sometimes scared of new technology or any type of technology. Now we're into AI now. But I think once we get them on board and get them oriented to it, they're going to get so used to it. It's going to be second nature. Implications for nursing practice include collaborating with information technology vendors to design, to develop, and implement clinical workflow systems that are intuitive, affordable, and versatile. So the conclusion, exploring the perceptions and the benefits of integrating QR codes in the classroom allows for a deeper understanding of the technology and facilitates successful integration. Students and faculty overwhelmingly agreed that QR codes are beneficial to the learning process, as 74% of students and 100% of faculty agreed that QR codes enhance the quality of learning. Additionally, students revealed that QR codes allow for instant connectivity, as 96.3% of students and 100% of faculty agreed that QR codes enable quick access to information. 14 themes emerged that explore faculty members' perceptions of QR codes. Themes such as quick access to information, versatile learning strategy, positive learning strategy, enjoyable, high support for technology, and generational student appeal converged and with the descriptive findings. So for my references, I have them at the bottom of the QR code, and these are just references for my poster board and not for the full study. But that was kind of quick. So I thank you guys so much for allowing me to present my poster board, and I'll stop sharing.